Okay, let's unpack this. Imagine walking into a patient's room, and they're curled up, curtains drawn, not making eye contact. Their pain is obviously unmanaged. What's the immediate thought that comes to your mind beyond just addressing their physical discomfort?
Well, it's fascinating, isn't it, how deeply a person's view of themselves impacts their health, their recovery, their whole well-being, really.
Right.
Today, we're doing a deep dive into this critical concept of self-concept in nursing. We're drawing insights from Fundamentals of Nursing by Potter, Perry, Stockert, and Hall.
Yeah, foundational text.
Exactly. We'll explore how this shapes patient care, clinical decision-making, and truly patient-centered practice.
And our mission today is to equip you, our listener, with a really clear understanding of self-concept. What are its components? How does illness affect it?
Yeah.
And most importantly, how can you as a nursing student or a professional actually apply this knowledge in real-world settings? We want to connect it directly to NCLEX competencies, best practice,
Yeah.
all through the lens of one patient, Mrs. Johnson.
Ah, yes, Mrs. Johnson.
She's 52, recovering from a radical mastectomy. She's withdrawn, silent, feeling, I think the word she used was disfigured. We'll follow her journey to make this all feel really tangible.
That's a great way to frame it.
So when we talk about self-concept in nursing, what exactly are we referring to? Is it just like feeling good about yourself? How's it different?
That's a really great question because they sound similar, but they're distinct. Self-concept is essentially your view of yourself.
Okay.
It's subjective, right?
Okay.
A complex blend of conscious, unconscious thoughts, your cultural identity, how you cope, your perceptions. It's the whole who am I question.
Got it.
And self-esteem. That's how you feel about yourself, your overall sense of self-worth. Think of it as your personal evaluation. Are you capable, worthwhile, competent?
Okay. The evaluation piece.
Exactly. And as nurses, understanding this difference is absolutely crucial. It guides accurate assessment and helps develop a truly individualized care plan. We have to move beyond just the surface symptoms, you know.
That makes so much sense. We see patients grappling with threats to their self-concept all the time, don't we?
Constantly.
Like, think about someone who's always been super active, suddenly facing a loss of bodily function, or someone managing a chronic illness that just changes their entire daily life.
Right. These aren't just physical challenges.
Yeah.
They drastically change how a patient sees themselves. And your sound clinical judgment, how you select the right nursing interventions, that becomes essential.
So the right intervention can actually bolster their self-concept.
Absolutely. When components of self-concept strengthen, patients gain successful coping strategies. And that leads directly to improved health-related quality of life, better health outcomes overall.
Wow.
Yeah, a patient with a stronger self-concept, for instance, is far more likely to actually engage in self-care, adhere to treatment plans. It really impacts every single aspect of their recovery.
So where does this all begin? I mean, this journey of self-concept and self-esteem, it isn't something we just develop overnight, right?
Yeah. Oh, definitely not. You're right. It starts incredibly young. Parents, primary caregivers, they lay the groundwork. And even the clarity of a parent's own self-concept can profoundly influence a child's development. Culture plays a huge role, too, internalized right from childhood.
So that's why there's such an emphasis on fostering it early.
Exactly, especially in school-age kids. It's interesting, young children often have this, positively inflated view of themselves. They see their abilities maybe a bit more highly than others might.
That's a powerful foundation. But then adolescence, that seems like a really critical, maybe turbulent period for self-concept.
It absolutely is. Adolescence is where Erikson's psychosocial theory becomes such a vital framework. You know, each stage builds on the last. Successful mastery leads to a solid sense of self.
Right, the sages.
And the core developmental task here is identity versus role confusion. Teens are rethinking their previous self, experimenting with new roles, new life plans.
It sounds intense.
It can be, and it's interesting, our source notes that while self-esteem often increases in early and middle childhood, it can fluctuate quite a bit in adolescence.
Okay.
But then, here's a fascinating trend. Self-esteem often increases strongly in young adulthood, and it can potentially peak between 60 and 70 years of age.
Really, between 60 and 70. That challenges the common idea that it just declines with age.
It does. It shows how life experiences in older adulthood can actually strengthen a person's sense of self, even as they face, certain losses.
So it's definitely not a straight line up or down.
Yeah.
And in adulthood, the goal is more about finding that stable sense of self.
Precisely. Establishing a stable sense of self that sort of transcends different relationships and situations becomes key. Think about job satisfaction. It's closely linked to self-esteem.
Oh, yeah.
And conversely, losing a job can significantly diminish a person's sense of self, their motivation. It impacts self-perception, even self-care practices.
And for older adults?
Cultural identity remains a major element of self-concept. And while self-esteem can diminish in very old age, maybe due to accumulated losses, friends, loved ones, functional status, independence, those with clear self-concept often show greater psychological well-being.
This all loops back to Mrs. Johnson, doesn't it? It's so clear that physical health and self-concept are just deeply intertwined.
They truly are. There's this close relationship between how individuals view themselves and how they perceive their health. Low self-esteem can actually be a risk factor for health problems,
Right.
while higher self-esteem and strong social relationships often support good health. Illness, hospitalization, surgery, these profoundly affect self-concept.
Like with Mrs. Johnson's mastectomy.
Exactly. And chronic illness, think about it, it doesn't just impact physical health, it affects finances, relationships, which then directly impact self-esteem, identity, roles.
It makes you think how a patient with poor self-concept might feel maybe unworthy of care. Does that influence their decisions?
Definitely. It can influence healthcare decisions, even struggling with simple choices like what to eat. You need to listen for those cues, like it's not worth it anymore, or I can't stand to look at myself.
Those are really powerful indicators.
Oh.
Okay, to understand this better, let's break down those three core pillars you mentioned: identity, body image, and role performance. What's the essence of identity?
Identity is your internal sense of individuality, wholeness, consistency across time and situations. It's about being distinct, separate from others, living an authentic life.
How does that develop?
Well, children start learning culturally accepted values and roles, identifying with parents, then later teachers, peers. Achieving this sense of identity is foundational for developing intimate relationships later on.
And culture.
Cultural identity, with its traditions and customs, can be a really powerful protective factor. It fosters pride, self-esteem. But we also have to acknowledge the stark reality that discrimination and prejudice can, unfortunately, profoundly influence self-concept negatively.
That's a critical point. Okay, body image. This seems incredibly relevant to Mrs. Johnson's situation.
Absolutely vital. Body image is about your attitudes toward your body, physical appearance, structure, function. And these mental images aren't always consistent with reality, are they?
No, definitely not.
Most people experience some dissatisfaction, but it can get greatly exaggerated when health status changes, like after an illness or surgery or trauma.
And normal development plays a role too.
Huge role. Think puberty, aging, they profoundly affect body image. Consider an adolescent girl with a distorted body image viewing herself as fat, potentially leading to disordered eating.
And for Mrs. Johnson.
Her unexpected radical mastectomy fundamentally altered her body image. And what's crucial here, too, is society's response. Cultural attitudes towards ideals like youth, beauty, wholeness, they play a huge role, for better or worse. We see this reflected, for instance, in cultures where girls report less social pressure for thinness, often having more favorable body images.
That brings a deeper perspective to her feeling disfigured. Okay, the third pillar, role performance. How do we define that in this context?
Role performance is how individuals perceive their ability to carry out significant roles like being a parent, a supervisor, a partner. Normal maturation brings changes in roles, right? Like a man becoming a father requires adapting behavior to be successful.
But stressors can interfere.
Yes, absolutely. Leading to what we call role stress. There are a few types. First, role conflict. This happens when you're trying to assume two or more roles that are inconsistent or contradictory.
Like the sandwich generation example.
Exactly. A middle-aged woman navigating being a parent to teens while also being a child to aging parents, caring for both simultaneously. Huge conflict.
Okay, what else?
Then there's role ambiguity. Unclear role expectations. This can create immense stress and confusion. It's common in adolescence or maybe in a new job.
Makes sense.
Role strain kind of combines conflict and ambiguity. It leads to feelings of inadequacy, like maybe when you're caring for a chronically ill family member. And finally, role overload. Simply having more roles or responsibilities than you feel you can manage. A very common challenge in modern life, right? All of these put stress on a patient's self-concept.
It really sounds like having strong self-esteem acts as a kind of buffer, a protective factor.
It really does. Individuals with high self-esteem are generally more resilient, but low self-worth. That can lead to depression, anxiety, even risky behaviors like substance abuse, especially in young adults, where we sometimes see the highest rates of depression.
And illness itself is a major hit to self-worth.
Direct impact. Illness, surgery, accidents, chronic conditions. For children and adolescents, chronic illness makes them particularly vulnerable. For older adults, health problems, declining socioeconomic status, loss of loved ones, all significant stressors.
Is there evidence connecting this low self-concept to specific risky behaviors?
Yes, the source highlights evidence-based practice showing how low self-concept increases the risk of adolescent drinking and drug use. But importantly, it also shows that nursing interventions can help. Things like stress management techniques, teaching coping skills, family health education, encouraging physical exercise. These can actually build self-compassion and resilience, reducing those risks.
So as nurses, our very presence, our actions, they can profoundly influence a patient's self-concept.
Profoundly. Your acceptance of a patient with an altered self-concept can promote incredibly positive change. Sometimes it really is as simple as sitting, listening, forming that therapeutic relationship.
Like they're being there.
Your genuine interest and acceptance make a huge difference. And this raises an important point about us as nurses. Our own self-awareness is critical.
How so?
Well, how do your nonverbal cues affect patients? What are your personal values, and how might they influence your approach? Can you maintain a non-judgmental attitude even when beliefs differ? You really need to assess and clarify your own self-concept issues before you care for patients.
That's a challenge. And when a patient's physical appearance has changed, like Mrs. Johnson's mastectomy scar, what's our role in that specific moment?
A positive, matter-of-fact approach is key. It provides a model for the patient and their family. For Mrs. Johnson, imagine if a nurse had a shocked expression when seeing her scar.
Oh, that would be devastating.
It could significantly contribute to a negative body image. Conversely, a simple, calm comment like, "This wound is healing nicely," is a powerful affirmation. You have to anticipate your personal reactions, acknowledge them, and always, always focus on the patient. Ease any potential embarrassment, frustration, anger, denial they might be feeling.
Okay, let's put all these theoretical pieces into action now, using the core framework of nursing practice, the nursing process. It's fundamental, a core NCLEX competency, and so vital when addressing something as personal as self-concept.
Exactly. Let's start with assessment. Your skills in interviewing, active listening, observing nonverbal behaviors, they're critical here.
What are we looking for specifically?
You're looking for cues that reveal their identity, their body image perceptions, how they view their roles. Then you determine their overall perceptions to get a sense of their self-esteem. Look for behaviors like avoiding eye contact, slumped posture, maybe an unkempt appearance, or being overly apologetic. These are common signs of altered self-concept.
And the questions we ask.
You're not just looking for facts, but insights. Questions like, how would you describe yourself now? Or how does this loss of hand function affect your roles and your independence?
This is where Mrs. Johnson's story really helps connect the dots, I think. Catherine, the nursing student in the case study, found Mrs. Johnson curled up, crying in that darkened room.
Right, and her pain wasn't managed by her PCA.
Exactly. The patient-controlled analgesia wasn't enough. And Mrs. Johnson felt disfigured, less than a woman, struggled to talk to her husband, and felt totally useless from just information overload about her treatment.
Her story is so crucial for the next step: analysis and nursing diagnosis. Her statements about disfigurement, not wanting to see the surgical site, that clearly supports disturbed body image related to negative view of self after mastectomy.
Okay.
Her restless nights, the unmanaged pain hitting 9/10, that led to acute pain related to mastectomy incision.
Makes sense.
And her worries about the future, feeling useless from all the information, that pointed to anxiety related to success of future treatment and also situational low self-esteem related to breast cancer diagnosis. This is where you really have to differentiate between similar diagnoses, cluster those cues to pinpoint the most appropriate ones.
Then comes planning and out comes identification.
Yeah,
And this phase is all about collaboration, right?
absolutely. You work with the patient, identify individualized, realistic, measurable outcomes together.
So for Mrs. Johnson's disturbed body image,
A key outcome might be Mrs. Johnson verbalizes improved feelings of self-acceptance and self-worth by discharge. And sound clinical judgment is paramount here. Well, for Mrs. Johnson, managing her pain was the primary priority, because relieving that pain freed up her physical and emotional energy to actually start addressing her body image concerns, you see.
yes, you have to address the most pressing issue first.
Precisely. And you don't do this alone. Collaboration is key with the whole healthcare team, family, significant others, maybe community resources like mental health clinicians or social services.
So Catherine, this student, worked with Mrs. Johnson and an oncology nurse specialist.
Yes, they prioritized pain control, respected her initial unwillingness to view the incision, but also planned ahead for discharge education and involving her husband, Mr. Johnson.
Okay, moving to implementation. This is where those strong communication skills in the therapeutic relationship really come into play.
Exactly. Think about health promotion. Nurses are uniquely positioned to identify lifestyle practices that might put self-concept at risk. We help patients gain insight, provide teaching, make referrals.
And in acute care, like with Mrs. Johnson,
Catherine prioritizing that acute pain was crucial. It meant Mrs. Johnson had the energy to begin dealing with the body image changes. Catherine also adjusted hygiene practices to respect Mrs. Johnson's readiness, observing carefully when she started to take those small looks at her incision. It's about meeting the patient where they are.
what about restorative and continuing care, like home care?
In home care, nurses have a great opportunity to help patients gain self-awareness, maybe reframe thoughts more positively, apply effective coping mechanisms. It's really about creating opportunities for success and reinforcing their strengths over time.
Is there specific patient teaching involved?
Definitely. The source mentions teaching objectives like helping patients identify strengths and weaknesses, discuss stressful situations, explore coping resources, and using the teach-back method is a fantastic way to evaluate if they've truly understood the information.
Great tip. And finally, evaluation. How do we know if our interventions actually worked?
Again, collaboration is essential. Talk to the patient, talk to the family. Did they feel their expectations were met? Are they satisfied? You also look for those behavioral indicators of progress.
Like what?
Improved eye contact, maybe increased social interaction, better self-care, and signs of accepting the changes they've experienced.
And how did Mrs. Johnson's journey conclude in the case study?
It ended positively. Her pain was controlled, she was able to view her incision, she understood her care and could demonstrate it, and she felt less anxious. Importantly, both she and her husband engaged with the oncology nurse and connected with the support group.
That's great to hear.
But it's really important to remember and to tell patients and families that adjustment to major changes in self-concept, like a mastectomy, can take a year or even longer.
That's such a crucial point. It's not a failure if it takes time.
Absolutely not. It's normal. Educating them about that timeline is part of supportive care. It doesn't mean they're failing to adjust.
That's such an important message. It truly is a marathon, not a sprint. So thinking about all this, as you, our listener, step into your practice, maybe consider this. How might understanding a patient's perceived ideal self compared to their actual self-concept unlock deeper insights into their struggles and guide your most impactful interventions?
Yeah, that's a deep question. We've really emphasized the profound influence you, as a nurse, have on a patient's self-concept, and how applying that nursing process assessment, diagnosis, planning, implementation, evaluation using sound clinical judgment is just fundamental to providing truly patient-centered care and supporting their holistic well-being.
Thank you so much for joining us on this deep dive. We really hope this exploration has given you valuable tools and insights for your own nursing journey.
Keep learning, keep questioning, and keep making that profound difference in your patients' lives.